One of Donald Trump's biggest applause lines on the campaign trail, and I'm not talking about the wall.
When we win on November 8th and elect a Republican Congress, we will be able to immediately repeal and replace Obamacare. Have to do it.
Trump has proposed some alternatives to the Affordable Care Act, such as letting insurers sell policies across state lines, making insurance premiums tax deductible, and promoting tax-free health savings accounts. But an all-out repeal would mean around 20 million people would lose their insurance. Could it happen? Joining me now is a man who knows a thing or two about the inner workings of federal health agencies. Dr. Donald Berwick is President Emeritus and Senior Fellow at the Institute for Healthcare Improvement and the former administrator of the Centers for Medicare and Medicaid Services, a job he took just a few months after the Affordable Care Act, Obamacare, was signed into law. Don, it's good to see you. Thanks so much.
Good to see you, Jim.
Repeal and replace are obviously buzzwords. Does that include your understanding? I know there's not a lot of meat on the bones. An end to universal coverage, those 20 million people that got insurance that never had it, are they gone theoretically?
Well, they're talking mostly repeal so far. We haven't seen the replace. But, yeah, if they follow through on what Trump has said in his campaign and what Paul Ryan, probably Trump's mentor in this, has said in his proposals, it's devastating. 20 million or more people would be thrown off
And
coverage.
You told me today that having them stay covered is cheaper to the feds, to the federal government, than have them being uncovered.
It's the Congressional Budget Office that's saying that.
Why?
Well, because
they don't go to emergency rooms as much? Why?
It's complicated. Obamacare has some revenue sources in it which go away if you throw out Obamacare. There are ways that Obamacare recovers funding, and these people, the people don't go away. They still need services. It may not be on the federal rolls if Obamacare goes away, but the states are going to pay a ton.
What are the things that are most troubling to you about what you have heard? Is it the health savings accounts? Is it the tax deductibility? What about this thing which I never understood, this allowing insurance companies to cross state lines? What's the deal with that?
I don't think that's an important matter.
Why? It's not competition that would lower prices?
I doubt it. It's big money getting bigger. It's big insurance companies can expand. Here in this state, in Massachusetts, we have local insurers, Blue Cross Blue Shield of Massachusetts and Tufts and Harvard Pilgrim. There are people. They're local and they can adapt. I'm worried that this cross-state stuff is just big money. Another way that big money takes more money.
So if people in Congress say, there are some parts of this Affordable Care Act that people actually like and have made use of, the portability, the no ban on pre-existing conditions, keeping your kid on your plan when you're 26. How do they propose, or have they ever proposed, how to keep some of the good and pay for it if you get rid of the individual mandate requiring you to buy or pay a penalty?
The undercurrent, and the people I'm talking to say they're going to do something that looks like they've repealed Obamacare but keep these provisions. You can't do. You tried to take away from Americans today the idea that the insurance companies can no longer deny you coverage, or the lifetime limits are gone, or your kids aren't covered. That won't sell. So my guess is there'll be something they'll do optically that will look like repeal, but they're going to have to find a way to keep those
because they're not going to want to make the constituents back home unhappy, even if they think they don't like the Affordable Care Act, but they love what's in it.
That's what's going on. They've sold the public on the idea the Affordable Care Act is bad, but the stuff in the Affordable Care Act the public generally likes.
You and I talked earlier today, it seems to me as a non-expert in the area, when I read comments from people like you about how pharmaceutical prices are the thing that's causing the huge spike in healthcare costs, he wants to allow Americans to import drugs from across international borders. I'd like to be able to do that. He wants Medicare that used to run to be able to negotiate, which it statutorily cannot, with pharmaceutical companies for prices. Those are terrific things, are they not?
They are good, absolutely. Drug reimportation would be a boon to individuals because a lot of that is out of pocket, and to the government would save about $20 billion.
Well, the Republicans in Congress, you had to deal with a lot of these people a few years ago, the early Obama years. Will they buy into that even if their new president, the new president of the United States, proposes those things?
I can't overstate how powerful the lobbyists are, and I think they'd have the same fight the Democrats would have when they propose that.
The one thing that I've never understood, the ban on Medicare, is they the largest drug purchaser in the United States? The ban on their ability, your ability in the old days, to negotiate drug prices, what's the public rationale for that? They can't say we're caving to the pharmaceutical. What's the public rationale?
I'm sure public may not understand that the largest purchaser of drugs in our country, maybe in the world, cannot negotiate for drug prices. That's in the statute. And you're seeing lobbyists from the drug industry convince Congress to do that, and the public really kind of remaining unaware of that.
Okay, so Republican control, whether you like, is the reality in Washington. Donald Trump calls you on the phone and says, here are my goals. It's not to destroy this. As he said in some event, I don't want people dying on the streets. Could you craft a replacement for the Affordable Care Act that met some of his goals without gutting it?
I don't. Things are interconnected here. For example, if you don't expand Medicaid, then there are a lot of poor people who can't get care. How are you going to cover them? Explain to me how people at 60 or 70% of the poverty line in Louisiana actually get coverage. You want to leave them out? That's not universality. On the exchanges, so you want people to get insurance so the risk pools work, but you're not going to subsidize their purchase or require the insurance companies to issue it. These things are connected, and the thing that Trump has lacked so far is a coherent, connected strategy. I'm open-minded if he came up with something. As long as we make health care a human right in America and do things that make it affordable, I'm for it. But Obamacare is it's the step we've taken so far, and they have not come up with a better idea.
And last thing, Massachusetts had Affordable Care Act before the Affordable Care Act. It was called Romney Care. Yeah. That would, even if this thing were repealed outright, a lot of the key provisions are in law in this state, and people in Massachusetts would continue to be protected. Yes,
yes, we would be better off than other states. We were better off than other states. We had 10% of people not covered when the country was at 20. So we're in better shape. But we're connected to the country. It does not help Massachusetts for us to be a country in which large numbers of people can't get care. And there are elements of Obamacare, covers for prevention, investments in innovations in care, new payment models that are part of Obamacare that would go away. We would do better than other states, but we're one country.
Hope Trump does call you. I doubt it, but I hope he does. Don Berwick, thank you so much. Good to see you.